The future of shoulder replacement surgery. Thank goodness I got two good ones right now. It has arrived in Grapevine, though. Baylor Scott White Medical Center, Grapevine, is one of a handful of hospitals in the nation with robotic surgery technology. Joining us tonight, Dr. Michael Kazam, complex shoulder orthopedic surgeon. Did I get that right?
That's right.
That's pretty good,
yeah.
Right? That's not bad. That's a long title. It's Baylor Scott White Medical Center, Grapevine. So first of all, talk to us about the surgery being available here. Why is this a big milestone? We don't all swim in the same pool you're in, so tell us why it's a big milestone.
Yeah, absolutely. So this is a big jump ahead of what we were doing before. We would first plan shoulder surgeries and shoulder replacements with x-rays. Then we got more sophisticated, doing it on a computer with technology in 3 dimensions, but we couldn't translate that to actual practice in the surgery in the operating room. So now we've been able to do this transition by taking what we were doing on the computer and having a robot help assist in the surgery. So we're the first in the state to have this technology available to us.
Yeah, and I said in the intro to you that this is just a handful of places in the country. Do you see 10, 15, 20 years from now this becomes more of a normal thing across the country?
Oh, absolutely. I think it makes everybody more accurate. It makes us be able to reproduce our planning preoperatively and do that intraoperatively. And with the hip and knee history of being able to do this for the past 15 to 20 years, we're just taking that technology and moving it to the shoulder.
All right, so I'm going to ask you the obvious question. Captain Obvious sitting here next to you. So we hear the word robotic. Please explain to us and everybody who may be watching this, this is not an actual robot replacing you doing the surgery, because some people will conjure that thought up right away and maybe get the willies about it, right? So what is the reality of robotic surgery? What does that mean when I'm sitting in the office talking to you, we get in the OR, then what's happening? I want you there.
Yeah, so I still do the operation. It helps me put the implants in and make sure that the machining of the socket and the ball and socket joint to put the implants in the perfect position is done with the assistance of a robot, so we can't mess up what we're doing and mimic our plan from preoperatively.
So does it narrow down like how you're putting, and I hate to sound somewhat silly, but putting Humpty Dumpty back together in the shoulder sense, is it just that much more precise in the ability to help you as the human being who's on the other end of this whole thing?
Oh, absolutely. So we were millimeters accurate. Now we're micromillimeters accurate. So we are precise, and we're hoping that improves survivorship of implants by putting them in perfectly.
Yeah, and when we say the word robotic, I mean, I've told you before we even went on doing this interview, I've got friends who've been shoulder and other parts of the body as well. It feels like robotic is an option in more and more procedures today, especially when it comes to joint replacement, talk about knees and all that. Why do you think more people are choosing this route? It sounds like I know why you like this route. Why are your patients choosing it more and more?
I think you hit on it before. So people have had their hips and their knees replaced with the robot-assisted surgeries, and they've had excellent outcomes, and they want to have the same thing with the shoulder.
Okay. Who's a good candidate for shoulder replacement surgery? Let me start with that. And don't stare at me.
So, I mean, somebody who's had long-standing history of shoulder pain, has radiographic findings of a bad shoulder, arthritis, bad rotator cuff disease, and it failed all the conservative measures, injections, therapy, medicines, and it's just affecting their life.
Right, and explain that too as well, because this is not, oh, my shoulder hurts, oh, let me go get it replaced. There's a long list of stops along the way before we get to replacing a joint in a shoulder, right?
Oh, absolutely. I tell my patients we're usually friends for a long time before we go to the operating room, because we've done all these conservative measures first.
Right. The fact that you are in charge of this operation here in North Texas, and we're one of just a handful in the country right now, what does it say, the achievement, if you will, about the future of orthopedic cases and surgeries right here in our own hometown?
Oh, it's very exciting. This is a big milestone. We're bringing things that only places like the Mayo Clinic and Cleveland Clinic had at their disposal, and now we have them here in Texas.
Right. Dr. Kazam, I just want to shake the hand of the man.
Thank you.
My shoulder. I'm kidding. Dr. Kazam, Baylor Scott White, thank you for being here. Good education for us. I appreciate you.
Yes.
All right. Saved a $35 copay just for you.